Welcome to the second series of webinars on population health.
The Sussex system came together and committed to addressing health inequalities for some of our most underserved and underrepresented communities through our shared strategy Improving Lives Together.
In the KSS region, a multi-agency community of practice for those working with migrants and asylum seekers, which comprised 90 delegates, were asked what would better help the mental health of migrants and unaccompanied asylum-seeking children. What came out really strongly was that communication was a key barrier. Staff recognised that the children they work with are often traumatised, have mental health needs that are not being met. They come from a range of cultural backgrounds and respond in various ways to different communication methods.
And in the February 2017, I was 60 years of age. I also started feeling a bit of a groin strain, and this groin strain got progressively worse. Got to April, I ran the Paris and Manchester Marathon a week apart as training runs for comrades, and then the groin pain was reaching the point of being unbearable. I got a telephone call from him on the Tuesday after the CT scan, 8 o'clock in the evening, and he said, "I'm 99% certain you've got prostate cancer, and I'm calling to tell you because you need some more urgent diagnostic tests." Black men are at twice the risk of white men. It's also worth mentioning that black men generally, when they are diagnosed with advanced stage prostate cancer, tend to fare less well. They also tend not to engage in clinical trials to the same degree that white men do.
It is my belief that data is a new currency for driving the diversity agenda. Without data, what are we doing? And we are data rich in today's society. We have a lot of data, but how are we using that data? It was great that Lucy earlier talked about intersectionality, and it's my passion and dream to see organizations start to use data in a more informed way. So rather than looking at how many men do we have, how many women do we have, how many people with disabilities do we have, we should be able to be going into organizations and saying how many women from Black African background are at potential perimenopausal age that will need reasonable adjustments. And we do that through diverse data profiling rather than just using data in a binary way. So it's really important that the data helps us to inform our decisions.